Good afternoon, everyone. Welcome to Texila American University's webinar on Nursing as My Dream Career. On behalf of Texila American University, we welcome the speaker, Mrs. Lupia, who is our head of the Department of Nursing. Mrs. Lupia has registered herself with the General Nursing Council of Zambia in 2006 and has been an active member of Zambian Union of Nurse since 2008. In the year 2006, she has started her career as an enrolled nurse with Ministry of Health. After playing various nursing related roles in different organizations, she is currently our head of the Department of Nursing Department. So on behalf of the audience, we welcome you, Mrs. Lupia. So you can please share your screen and you can go ahead with the presentation. And I would be taking care of upon admitting the participants because we have more participants who are joining the session. So we don't want to delay the session. You can start your session. And the participants during this session, if you have any questions, you can please feel free to ask. And you can just raise your hands if you have logged in using the Zoom app, or if you have any questions, you can always drop the question in your chat box. At the end of the session, the speaker would be in a position to address all your questions. Thank you so much.
Thank you so
Speaker,
much. Thank you so much, Mr. Regional Manager, sir. Good afternoon, listeners. Good afternoon, viewers. Thank you very much. As I have been introduced, I'm head of nursing here at Texila American University, and I'm here to present with you nursing as my high school dream career, where we are going to interact so that if you have any questions, you can continue afterwards and ask, and then we can interact. I'll present to you. I'll start by defining what nursing is. Nursing is simply a profession or practice of providing care for the sick and infirm. So when we talk about the infirm, we talk about people who are unwell. We have a nurse there who is attending to a patient. Now, who is a nurse? We say a nurse is a person who cares for the sick or infirm, the unwell. Specifically, this person has to be licensed healthcare professional who practices independently or sometimes is supervised by a physician, surgeon, or dentist, and who is skilled in promoting and maintaining health. Definitely, you need to be qualified. So what is the aim of you training as a nurse? So when one is trained as a registered nurse, he or she will be self-directed. You will be analytical. You will need that knowledge, so you'll be knowledgeable. You'll be skillful. Skillful meaning you are hands-on and responsive to changing health needs, emerging diseases, and contribute towards improving the quality of care being provided to individuals, families, and communities in Zambia and worldwide. Obviously, there are a lot of new diseases, including the latest one which we are having, which is COVID-19. So if you are trained, obviously you'll be knowledgeable and you'll be well vested and you attend to the clients appropriately, thereby protecting yourself and the people around you. So what are the competence areas? So if one is trained as a registered nurse, you will be expected to do clinical nursing practice, meaning you will be attending to the clients. You have that professional, legal, and ethical nursing practice. You will be protected. You will be a professional in what you do. You will be licensed. You will be able to offer health promotion and also health communication because you'll be knowledgeable and you'll be able to give appropriate nursing care and nursing health education to the clients. Obviously, a registered nurse is involved in management and leadership roles, so you'll be able to become a manager. You manage yourself and others. well and competently, and you'll be able to research. Obviously, a registered nurse is a researcher because they will need to look at the new or current problems that are coming up in terms of illnesses or any other things around them. They are supposed to open up their eyes and research and find answers and be able to answer those problems. Personal effectiveness and professional development, you don't just need to remain as a registered nurse. Obviously, you need to upgrade. Also, mentorship and coaching, you'll be able to be mentored, and also you'll be able to mentor others and coach others who will be working with you. So the program itself, as registered nursing, the duration is 3 years for direct entries. What do we mean direct entries? It's a person who has just completed her grade 12 or his grade 12, which is GCE. So as long as you meet the necessary qualifications, which we'll talk about, you'll be able to train for 3 years. The courses are allocated according to hours per year. So in the first 6 months, in the first year, we have 5 courses where we offer sociology, psychology, professional practice, nutrition, as well as microbiology. And within the first year, we include the full courses. These full courses, we mean a course will start in January and it will go up to December. So we have public health nursing, we have anatomy and physiology, because as a nurse, you need to know the anatomy of a human being and how the system works. That is anatomy and physiology, and also fundamentals of nursing, where you're supposed to know how to handle practically the clients. So the other 4 courses that we include after the first 6 months, we also incorporate surgery 1, and we incorporate medicine 1, as well as pharmacology, because you need to know what type of medications are we going to be giving our clients, its efficacy, how does it work, and is it the correct medicine that we are giving for the specific condition. In year 2, we'll have surgery 2, we'll have medicine 2, we'll also incorporate pediatrics and research, and what we call obstetrics and gyne. At the moment, we are calling it integrated reproductive health. So in year 3, we'll have leadership and management. We'll also include mental health nursing. Then we'll continue with the pediatrics that we started in year 2, and also the integrated reproductive health, medicine, and surgery. So basically, these will be the courses that you finish with at the end of it all. And these will be the courses that you'll be examined on, though they will incorporate some of the areas from the courses that you might have undertaken from year 1 up to year 3. But the papers that will be produced by General Nursing Council will be leadership and management paper, mental health nursing paper, pediatrics, integrated reproductive health, medicine, and surgery. Though these papers will be coming as paper 1, paper 2, paper 3, and so on and so forth, of which an example, paper 1 will be pediatrics in nursing. So what is the entry qualification? The minimum entry qualification, the requirements will be 5 O-levels or better of GCE, where obviously you need to have 6 or better, which is credit or better in English, mathematics, and any science. Then you include 2 more of any other courses. Minimum age entry is 16 years. Maximum, we've never heard about it. So even anybody beyond 50, like we had or we read, if you are so conversant with Facebook or social media, we saw that there is a lady from Southern Province who just graduated as a registered nurse above 50 years. So why choose Texila? Texila has qualified members of staff who are registered with appropriate regulatory bodies and is licensed to train registered nurses with General Nursing Council of Zambia. Texila has adequate classroom space and a well-equipped library with latest books. So Texila has an e-library, meaning you are able to connect via internet and access these books. And the institution has best practices with conducive environment for learning with components like labs, laboratories, we have classrooms, we have overhead projectors, we have hostels, etc. So that is just an example of how our skills lab looks like. It is well equipped, as you can see from the background. Texila has a well-equipped skills lab, as we mentioned, for nursing practice. So most of the times, if you're training from here, you're able to go and find yourself in the skills lab and do your practicals from there so that you can be well vested with what you're expected to do from the wards. So Texila has an advanced learning system where students are oriented on how to use electronic system, that is computers. So you'll be trained because most of the work you'll be required to do it electronically. So that is our skills lab, well-equipped skills lab. So Texila, in the event of an eventualities like epidemics like we have now, or disasters, new trends, etc., we do not stop training students, but rather offer online studies in order to keep the students going. So no single year is lost. So what do we mean? In the events that you are asked to stay home, we'll still connect you and we'll continue teaching you whilst in the comfort of your home. Texila uploads notes. So we do upload notes prior to your lecture. And then we also give assignments according to General Nursing Council standards. We also do discussions with members. And then we also allow you students to access all our notes and assignments online from wherever you can be. So Texila has also got a memorandum of understanding with the big hospitals in Lusaka, and students are free to practice from there. So we take our students to UTH, Levi, Maina Soko, to mention but a few. Texila has a flexible payment plan in terms of school fees, and any well-meaning Zambian can manage. So how then can you progress as a registered nurse? We have what we call specialties, so it's up to you. You can become a theater nurse after attending your diploma. You can become a pediatric nurse, a nurse midwife, psychiatric nurse, ophthalmic nurse, to mention but a few, but you need to train for another extra 1 year to become a specialty nurse. So once you get your diploma, apart from the specialty that you can go for, you can also go for a degree program, which Texila is still offering. So you can enroll and pursue your degree. You can also pursue your master's after attaining your degree, and you can further progress to a PhD. So our vision as Texila is to be recognized as a leader committed to excellence in higher education, research, and innovation that meets the aspirations of the global community. So what are the benefits for you when you train as a registered nurse? Obviously, there's job security. When you are employed, everyone is looking for a registered nurse everywhere to offer their services. So you are assured of getting better job opportunities in varying job areas. So it's not only government, even private sectors, they are looking for a registered nurse. There's also flexible work schedule. We don't work the whole day or the whole night. We've got shifts, and these are 8 hours shifts. So You can even work night duty 1 week and rest for another week. So career flexibility, also high salary package because it is competitive, mental satisfaction, also traveling assistance because you'll be able to move even worldwide and attain or find your job. Is it worth to train as a registered nurse? I can tell you school is not easy. So if you are not sure you want to become a nurse, the answer is probably no. But if you feel led to be a nurse and you want the most fulfilling career on the planet, it's totally worth it. I have been a nurse over 15 years and I have enjoyed my work. In summary, the roles of the registered nurse agitate the formation of new perspectives. The responsibilities range from simple to complex. So it's up to you. You need to be ready to be challenged by different work areas that you go and face out there. They include performing physical examinations, meaning you need to attend to this client, you need to look at this client critically before you give them a diagnosis. The promotion of health through sensitization, you need to talk to the public, the communities, so that we promote behavior change. Also, administration of medication and individualized care, because we do not manage our clients as a whole. We manage clients as an individual and with the problems that they present. So nursing is an ethical job that is needed throughout the world. So you need to give out the best and work professionally. It exists in the modern age as a way to care for and to help people and to maximize the way we treat people. Nursing is also very ethical. Each patient is taken care of differently. We do not compare our patients, like just because that one came in with a headache and then this other one comes in with a headache and they are crying, you start referring, look at your friend. Them, they are not crying, no. Each client is special. We treat them differently and have different choices according to their ethics. Thank you very much. We'll be able to open for questions, concerns, or contributions.
Thank you, Speaker. It was a wonderful presentation. So
Thank you.
now the floor is open for questions. So if you have any questions, you can unmute your mic and you can ask the speaker about how, in terms of the lab facilities, in terms of the admission procedures, in terms of the way how the teaching methodology is being done in Texila when compared to other schools. So the floor is open for all such questions. So if you have any questions, you can unmute your mics and you can go ahead and you can ask the question. Or if you want to drop a message in a chat box, you can drop a message so that I would be able to deliver the message to the speaker to address your concern. Yes, we have the first person unmuted, Niambi Piri. Yes, please go ahead, Niambi.
Okay, good afternoon. Thank you for having me. I wanted to ask, in a case that a student is training with you and they happen to be pregnant, how long do you give maternity leave and how do they continue learning with you? Thank you very much.
Okay, can I pick up that?
Okay, speaker, the question by, so you got the question, speaker?
Yes, I did.
Yeah, please go
Okay.
ahead.
Nyambe, thank you very much for the question. So pregnancy is not a restriction to training or attaining your diploma. So what we do is we'll continue going by General Nursing Council regulations. We'll continue training you or having you around until at such a time when you are about to go and deliver. Then we'll give you maternity leave for a month so that you go and wait, you deliver, and then you write to us. We'll give you time to feed the child for 3 months, and then we'll allow you to come back. Nyambe, did I answer?
Yes, thank you very much. You answered the question very well. Thank
You're
you.
welcome.
Thank you, Speaker. Thank you, Niambe Piri. So anyone has any other questions? Okay, so
Yes,
Speaker,
sorry.
we have a
I
question
have a,
from Enoch. Yes, Enoch, go
yes.
ahead.
What if with circumstances someone fails to finish up payments in the maybe in the second year, first semester? What happens then? Because circumstances may change that maybe I have my parents, then the parent dies, then you fail to finish up the payment. What happens then? Is there any help that the school does, or any sort of some help, so to say?
Okay, so
Okay.
Enoch, your question is based on the financial support if things are not
Yeah,
going in the right way. Is that right?
yeah, yes,
Okay,
please, yes.
okay, great. So actually what Texila does is Texila has a payment plan where the students can choose their own payment plan. They can either choose yearly, semester, or monthly or quarterly. In a situation where you are being pushed to not in a position to pay the fees, on a case-to-case basis, Texila will look into your situation, and then based on the situation, the university guidance counselors will advise you how to go forward.
Okay.
Okay,
All right. Thank you so much. You've answered my question.
no problem. Thank you so much, Enoch. Any other question, Priyanka? We are still waiting for your question. Okay, good. So Priyanka, your question is, when are you enrolling? June intake? No. As per the regulation from Nursing Council of Zambia, we have only 2 intakes, July and January. So currently we are enrolling for July 2020. The admissions are ongoing for July 2020. So hope I answered the question from Priyanka. If you have any other question, you can further again post it in the chat box so that the speaker will be able to address you in terms of academics. Yes, Joseph Banda. Yes, please unmute your mic. You are open to the question now. Joseph, you're unmuted. Please ask your question.
Oh, how are you, sir?
Yeah, good. Thank you, Joseph. Thank you for your asking. We are good. Thank you. Please go ahead.
Yeah, I guess training with Texila, it can be good, and it is good to train with Texila. I really appreciate it by looking for the structures and the things that are in there, like skills lab and whatsoever. Then coming to the method of payment, I'm clear and understood that you have the payment plan, where a student will choose either paying monthly, yearly, or semester-wise. So it is a good plan for the university to do that. Now my question is, how can someone or maybe a student be able to access to various sort of informations like for those who are coming from various rural areas where they don't have access to internet or something else. So how can the university be reliable for those students? And how can someone undergo the process of admission, or how is the admission process at Texila University? So that's all my sort of questions, sir.
Okay, fantastic, Joseph. In terms of the academic structure, the speaker, Mrs. Lupia, will be able to address. Once she's done with the academic procedures, then I'll explain you on the admission procedures. Speaker, you can go to the academic clarification, which was raised.
Mr. Joseph, thank you very much for asking. In terms of accessing academic notes or any other things, in case you are from a rural setup, we will need to make an agreement in terms of how you can easily access those things. Definitely, if it can't be just internet itself, if it is a challenge, nowadays people we have what we call WhatsApp. We can even just do maybe even we can even use Facebook. Any other thing we can arrange with you that will be appropriate depending with the area where you are. But nowadays technology, I think it's everywhere, and you can be connected from anywhere as long as you are having an Android type of phone. So I think accessing notes, it can't be a challenge with us. And obviously we'll be able to give you the books in terms of references, which ones you can use, and will suit the program that you are training for at that particular time. You can continue, Mr. Regional Manager, sir.
Thank you,
Hello?
Speaker. Joseph,
Yes.
yes, in terms of your admission procedures, if you're already in discussion, because Texila American University is having an option where students can register in online. I think Priyanka is also having the same question, that when are we giving the application forms? You can get, I'm sure that you're already in discussion with our team. Either you would be discussing with my colleagues, Memory or Chanel, Joseph or Abigail. If you're discussing with them, they would have already created an application for you guys. So what you need to do is you guys need to just send your NRC and your high school documents, as your high school certificate, a scanned copy, or you can take a picture and you can WhatsApp them. So they would be able to look into the eligibility criteria, because in order to do a diploma in nursing program, you need to have credit or better in English, Maths, and any one of the science subject, followed by two other any subjects. Either it can be a history, it can be a civic education, it can be a religious studies, it can be a metalwork, it can be an agriculture, it can be in biology, or whatever it is. So if you satisfy those requirements, then from there you would be given an eligibility letter to state that, okay, you have successfully been qualified to do diploma in nursing commencing July 2020. So with that eligibility letter, you would be seeing a minimum deposit amount that to be paid to process your admission letter, because diploma in nursing is a very competitive, and that too Texila is offering diploma in nursing program for the first time, which started in July 2020. So we have more application that has been lined up. So as soon as you send your documents, you will be getting the eligibility letter. And once the eligibility letters are processed, then you can make a minimum deposit and you can confirm your seat, so that that space will not be taken by your friends who are going to join you along with you for the batch. So with that, your admission letter will be processed, and you would be further doing some admission procedures. And once it is done, you would be enrolled into the classes. And once you're going to be into the classes, as explained by the speaker, internet is obviously, it is not a major issue at this current trend what we have. But the program is going to be delivered in full time. So you don't need to be more dependent on your internet, and you would be getting a free Wi-Fi. So I'm not sure how many colleges within Zambia, diploma in nursing colleges, are having an option where they give a free dedicated Wi-Fi up to 5 to 6 Mbps when you're in the campus. And you'll be having a free Wi-Fi access in the campus. You'll be uploading, you can download all the platforms from the campus. So if you, nowadays everybody's having a smartphone, so you can just download all your presentations in your phone, and you can go home and you can read. There is no need for internet. Yeah, Joseph, did you?
Yeah, you can share the emails or maybe the number. You can share the email or the number that we can use to send our document. We are interested to apply at Texila University.
So I have given the email address. You can always send your documents to this email address, and you can always reach our sales line in this. So you have the email address and you have the contact number to reach our sales department, which I have shared it in the chat. So everyone can make use of it. And if you're already in discussion with my colleagues, with my team here in Texila, then you can start continuing to discuss with them. And if you would like to go forward and start the communication for the first time with Texila in regards to your admission to diploma in nursing, then you can always feel free to reach me through this email address. And this is not my direct line, it is our sales line, which will be attended by our colleague. So they will be able to guide you on the admission procedures. Thank you, Joseph. Thank you for your wonderful question, and thanks for the compliments that you had given that Texila has in wonderful laboratories and other compliments what you had given in terms of our academic structure. Thanks for the compliments.
Thank you. Welcome.
So any other questions before we close up? Okay, so since there is no questions or no hands raised by our participants, so here we are ending our first session on Diploma in Nursing program about what is our Diploma in Nursing dealt by Texila and what facilities you have. And we will catch up you soon with our next session, most likely a couple of weeks from now in terms of what you're going to learn in depth at Texila with our well-infrastructured simulated laboratories. Thank you, speaker, for your available time on preparing a wonderful presentation. Thank you all the participants who are been in the session throughout and having more listening to the questions raised by your fellow participants. Thank you so much once again. Have a great and safe afternoon ahead. Bye-bye.
Thank you.